And so in Sjogren's syndrome, people develop dry eye because those glands can be attacked by an autoimmune process and not produce enough tears. We have testing for it in the office that we can do. It's called a Schirmer test. To see if someone is not making enough tears. And there are various treatments to try to increase tear production. So there's various drops that can be prescribed to help improve the production of tears. So I think the very first thing is if you have dry eye, if it's mild, you can just use some drops over the counter. But if it's more of a problem, then definitely talk to your eye doctor about, okay, which type of dry eye do I have? Do I need extra testing done? Do I need to be tested for an autoimmune condition? And also, ask your doctor for like a stepwise approach. First, try the simplest thing, the least invasive, then move on to maybe prescription drops. And now we have all kinds of other technologies and procedures we can do for dry eye. So that's kind of more for refractory people who are not responding to the other treatments.
Right. Absolutely. And I'm definitely one of those. So what about eye drops? I know we have a lot of allergies, watching screens, dry eyes. Do people do damage when they use some of the over-the-counter eye drops? Which ones do they need to stay away from?
Yeah, that's such a good question, Dr. Pinkston, because I don't know if anyone remembers, but about 2 years ago, this was all over the news, that there were recalls of these eye drops. And these drops were over-the-counter drops, marketed for dry eye and sometimes even allergy. The issue was that they were contaminated. And some of the bottles were contaminated with bacteria or fungus. And there were reports of people getting serious eye infections from using contaminated drops. And unfortunately, there were even reports of, I think, at least 2 people who died because the contaminated bacteria, the drop went into their system, got into their blood, and they developed sepsis and pneumonia. So it's crazy to think that people could die by putting in contaminated drops, but it did happen. This is again back 2 years ago in 2023. So the FDA keeps a list of all the recall drops. So if you're worried, definitely go check it. But there's even since then, there have been a